Hi, Dr. Nessim. How are you today?
Good. How are you?
Thanks for taking the time to talk to us a little about the SR&ED program. You're up in Ottawa, right?
Yes, I am.
So you're an oncologist, right?
Yes, I'm a surgical oncologist, so I operate on cancer patients.
Oh, wow. Okay, that's really intense work. And you have some other affiliations as well, right?
Yeah, so I am a surgical oncologist at the Ottawa Hospital, and I'm an associate professor at the University of Ottawa and a clinician investigator at the Ottawa Hospital Research Institute. So I have all three designations. I also happen to be the program director for the Complex Surgical Oncology Residency Program with the Royal College.
Oh, wow. Wow. Congratulations. I'm really impressed. So you are participating with the SR&ED program with Bond. What was your experience been like with the SR&ED program?
Wow, it's been fantastic. I have to say it's something I didn't know enough about. I've been doing research for close to 10 years now, and if I'm being honest, I wish I knew about it before. Because you do a lot of research with blood, sweat, and tears, and honestly, just from the goodness of your own heart, and you don't really know that these programs exist. So you tend to do it on your own time and after hours and on weekends, and you get personal satisfaction, but it's kind of nice to know that the government appreciates that work and recognizes it and is willing to fund it in part. And when I found out about Bond and I asked a few questions and did a few phone calls, it seemed pretty clear to me that there was no reason not to do it. My person is Andrew Niles, and he's been fantastic. And he helps a lot with figuring out how to put the application together, tons of guidance, a few conversations to explain what kind of research I did and if it qualified, and then finding the projects that do qualify, and then being able to put the application together. So it's been a good experience.
I know you had a short meeting with CRA last year, but it wasn't really an audit. It was just a short conversation. Did you feel it was a positive interaction with the government?
Actually, it was. I mean, it's a 2-hour long session. Andrew was luckily there. You get some tips and tricks on what they're going to talk about, so you're not completely going in blind, which is nice. But really, it was just about them showing you all the different forms that need to be filled out, the resources that are available to you. They were just very positive in actually wanting people to use this program. It almost maybe sounded underused. And they were quite keen that clinicians are aware and that researchers are aware, because this is a very big funding envelope, I would assume, of budgeting for the government. And, it was a generally positive interaction.
Right. And you've been practicing for 10 years, this is strange that nobody ever told you about the program before?
I'll be honest, I knew a little bit about it, but it was very much told to me, this is complicated, it's a lot of hours, it's too much work, don't bother, it's not worth the money. But then when I got the email from Bond about the program and just asking them a few questions, because you're so well versed in what's required, actually, my involvement and workload to make this happen was quite minimal. Andrew did all of the heavy lifting. I provided a CV, I provided hours, I provided conversations about my research and what the goal of my research is, and those kinds of things. But he's the one that put it into a nice, put together document and application. So the investment of my time was maybe an hour. And for I don't know if I'm allowed to say the amount of money I got, but it was definitely worth the hour.
Yeah, if you made that much money every hour, then that would be a good deal, right?
Yeah, very good deal.
Yeah. What would you say to other doctors that are maybe on the fence about participating in the SR&ED program? What would you say to them?
By the time you're in your third and fourth year and research is truly established and you're putting in research ethics board, things, and you're collecting data and you're analyzing and you're doing all this work on your own time, knowing about this program really makes a huge difference. My research involves large databases for very rare cancers like soft tissue sarcoma and gastric cancer, where randomized trials are just not possible because there's just not enough patients. And so, I think overall, it was very supportive of my research programs that honestly, because they're rare cancers, don't get the regular funding that other cancers get.
Mm-hmm.
And so you really are working off the side of your desk and from your heart, because these cancers are orphan cancers that don't get the funding like breast cancer and lung cancer that are massive, right? So when you're the surgeon or the physician or the researcher doing these rare diseases, these kinds of funding envelopes and strategies are extremely helpful to help with your research program.
Well, it's great that you participated in the program. I'm so glad to have you as a client of Bond Consulting Group. I'm so happy that you had an excellent experience with our team, and hope that we'll have many, many more years of working together. And thank you for taking the time to come and talk to us today and help us encourage and get the word out that more incorporated doctors should participate in the SR&ED program and have a great experience like you did, Dr. Nessim.
Thank you very much, Julia. I really appreciate all of the stuff that Bond's done for me.
All right. Thank you.
Thanks. Bye.
Nice day. Bye.